Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss how influenza has been fatal in adults and what steps should an individual take to protect oneself. Hello doctor, welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, can you tell us what is influenza?
Influenza is an infection of the nose, throat, and lungs, which are part of the respiratory system. Influenza is commonly called the flu, but it's not the same as the stomach flu virus that causes diarrhea and vomiting. Most people with flu get better on their own, but sometimes influenza and its complications can be deadly. People at higher risk of developing flu complications include young children under the age of 2, adults older than 65, residents of nursing home and other long-term care facilities, people who are pregnant or plan to be pregnant during flu season, people with weakened immune systems, American Indians or Alaska Natives, people who have chronic illnesses such as asthma, heart disease, kidney disease, liver disease, and diabetes, and people with a body mass index of 40 or higher.
What are the causes of influenza?
Initially, the flu may seem like a common cold with a running nose, sneezing, and sore throat. Colds usually develop slowly, but the flu tends to come on suddenly. And while a cold can be miserable, you usually feel much more worse with the flu. Influenza viruses travel through the air droplets when someone with infection cough, sneezes, or talks. You can inhale the droplets directly, or you can pick up the germs from an object such as telephone or computer keyboard and then transfer them to your eyes, nose, or mouth. People with the viruses are likely contagious from about a day before symptoms appear until about 4 days after they start. Children, people with weakened immune systems may be contagious for a slightly longer time. Common symptoms of the flu include fever, aching muscles, chills and sweats, headache, dry persistent cough, shortness of breath, tiredness and weakness, runny or stuffy nose, sore throat, eye pain, and vomiting and diarrhea, but this is more common in children than adults.
What are the risk factors of influenza?
Risk factors of influenza with the following reasons. Age. Seasonal influenza tends to have worse outcomes in children under age 2 and adults older than 65. Living or working conditions. People who live or work in facilities with many other residents, such as nursing home, military barracks, are more likely to develop the flu. Weakened immune system. Cancer treatments, anti-rejection medication, long-term use of steroids, organ transplant, blood cancer, or HIV/AIDS can weaken the immune system. The object can make it easier to catch the flu and may increase the risk of developing complications. Chronic illnesses. Chronic conditions may increase the risk of influenza complications. Examples include asthma and other lung disease, diabetes, heart disease, nervous system disease, metabolic disorders, problems with an airway, kidney or liver blood disease. Race. American Indians or Alaska Native peoples may have an increased risk of influenza complications. People who are younger than 19 years of age and receiving long-term aspirin therapy are at risk of developing race syndrome if infected with influenza. Pregnancy. Pregnant people are more likely to develop influenza complications, particularly in second and third trimester. This continues up to 2 weeks after baby is born. Obesity. People with a body mass BMI of 40 or higher have an increased risk of flu complications.
What are the complications of influenza?
If you are young and healthy, the flu usually isn't serious. Although you may feel miserable while you have it, the flu usually goes away in a week or 2 with no lasting effects. But children and adults at high risk may develop complications that include pneumonia, bronchitis, asthma flare-ups, heart problem, ear infection, or acute respiratory distress syndrome. Pneumonia is one of the most serious complications. For older adults and people with chronic illnesses, pneumonia can be deadly.
How can we prevent influenza from spreading?
WHO recommends annual flu vaccination for everyone aged 6 months or older. The flu vaccine can lower your risk of getting the flu. It can also lower the risk of having serious illnesses from the flu and needing to stay in the hospital. Vaccination is the best way to protect oneself from infection. Preventing the flu and lowering the number of people with severe flu and complications could also lower the number of people needing to stay in the hospital. Though influenza vaccination isn't 100% effective, it helps in reducing the chances of having severe complications from infection. Therefore, it is also important to take several measures to reduce the spread of infection, including washing your hands often with soap and water for at least 20 seconds in an effective way. In case of soap and water not being available, use of alcohol-based hand sanitizers. Avoid touching dirty hands to your eyes, nose, and mouth. While you cough and sneeze, do it into a tissue or your elbow and then wash your hands. Regularly clean often touched surfaces to prevent infection of spread of viruses, and then on your face. Avoid crowded places. The flu spreads easily when people are gathered in places such as childcare centers, schools, office buildings, auditoriums, or public transport. Avoid crowds during peak flu season reduces your chances of infection. Also, avoid anyone who is sick. And if you are sick, stay home for at least 24 hours after your fever is gone so that you lessen your chances of infecting others.
So, doctor, what message would you like to give to our listeners?
Vaccination is the best way to avoid the major risk caused due to infection. One should get vaccinated and help avoid the spread of influenza infection.
Thank you, doctor, for being a part of Medica Talks and sharing your insights. We are hopeful that this informative talk has enlightened the listeners about influenza and its risks and how one should get themselves vaccinated.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.